At Queen Elizabeth Central Hospital, a mother whispers prayers beside her newborn baby. Since he was born, his head has been increasing in size, a condition called hydrocephalus. The baby needs surgery, but before the operation to provide relief from his symptoms, he developed an infection caused by bacteria in the fluid around his brain, and the infection is not responding to locally available treatment. Doctors call this antimicrobial resistance, and it's a growing problem.
Previously, we had few cases, but I can say that as of now, we are seeing these cases quite often.
In 2019 alone, antimicrobial resistance claimed more than 1.27 million lives directly, and with 5 million deaths linked worldwide. Africa bears the highest death rate, 1 million lives lost each year. And by 2050, drug-resistant infections could kill 10 million people annually.
I've had about 2 patients who have grown a bug or grown a microorganism that is resistant to the first line of antibiotics. So now I have to switch them to a second line antibiotic, and that will affect the hospital stay of the patients, which in turn translates to a longer cost to the mothers and also a chance for the babies to get other infections in-house, so nosocomial infections. So these are most of the struggles that we're getting.
It's a big problem. Actually, it's a global public health crisis. It is affecting almost all the countries, especially the poor countries.
Here in Malawi, 8 in 10 infections in some hospitals no longer respond to ceftriaxone, our last line of defense. 70% of antibiotics are sold without prescriptions. One in 5 Malawians shares or uses leftover drugs. Misuse in hospitals, pharmacies, and farms is silently fueling a crisis.
Apart from stopping taking medications as prescribed by medical doctors, sometimes, in the community, someone may say, oh, I'm feeling sick. Do you have some medication that you can give me? People can ask even their neighbors or their relatives. So they are given the medications and they take.
Unfortunately, at the front line of this crisis are children. But it is not too late. Every hand washed, every prescription verified, every child vaccinated saves a life. If we act now, we can stop the next generation from paying the price. When medicines fail, humanity must not.